let alone the therapies that he needs every week. Right now, he is safely covered under Medicaid, but how long before he's not? Republicans want to make poor people jump through all the hoops in order to prove that we are worthy to live a healthy life. They don't realize and they don't care how impossible those hoops are to navigate for most of the people, and I always assume it's difficult because they want us to just give up. Every single day, my life as a poor person is spent jumping through hoops trying to make sure I can still afford eggs. I'm still waiting to afford eggs. Groceries, utilities, gas. No one should have to jump through more than one damn hoop in order to prove to anyone that we deserve to live happy, healthy lives. Every single day, I wake up scared. Every day feels bad. And that the Trumps, the Musks, and the Andy Barrs of the country just want poor people to not exist anymore. But every day, despite what they all think, we get up and we work hard and we keep on fighting and demanding the things that we all deserve because we are not parasites and we are worthy.
That takes so much courage. Thank you, thank you, thank you. And I hope you know you are not alone. We're all with you. And we're not going to let those bastards take away your health care. This impacts everybody. It doesn't matter where you live. It doesn't matter whether you're in rural Kentucky, whether you're right here in the city of Louisville, right? The state government, the federal government, the city government. Doesn't matter. And I want to welcome to the stage our awesome mayor, Craig Greenberg, to speak up about what this means for us here in Louisville. Let's go, Mayor.
Thank you so much, Congressman McGarvey. Good afternoon, everyone. Some may say that Medicaid is a federal issue. Call Congressman McGarvey. I beg to differ. This is an issue for everyone in every elected office, at every local, state, and the federal level. And so I'm here today as mayor of Louisville. I'm here today on behalf of Angela. I'm here today on behalf of my new friend Kimberly, who relies on Medicare to take care of her 3 children that have tremendous medical needs. I'm here today on behalf of the 250,000 Louisvillians who depend on Medicare when they get sick, who depend on Medicare when they need medicine, who depend on medicine when they need care. I'm here today on behalf of the other 500,000 Louisvilles who care about those 250,000 people who want to make sure that they get the care they need. I'm here today because, as Colonel Stevenson said, government work should work for the people, not against them. And I'm here today because health care is a right, not a privilege for all of you and for everyone else in our city and country. Friends, as we've all heard, there's this proposal right now that Congressman McGarvey is having to fight every day against. a proposal to cut nearly $1 trillion from Medicaid. It sounds crazy. I mean, this sounds made up. How can this be? But taking a chainsaw to this program will have devastating consequences. Devastating consequences to every hospital in our city. Devastating consequences to every healthcare facility, to every doctor that each of you and all those 250,000 people rely on across our city. Let's just take one example. One example that I'm very familiar with here in our city, family health centers. Family health centers, yes, indeed, they're awesome. They run 6 clinics here across the city of Louisville. They treat nearly 40,000 patients a year, half of whom rely on Medicaid. If we cut Medicaid, we can say goodbye to so many of the services that Family Health Center says that relies on. We can say goodbye to so many services that every hospital and every healthcare provider in our city provide to you and so many others. This means more overcrowded emergency rooms, more families who have to make that impossible choice about can they work or can they care for their loved ones. This is far too much for our city, for any city. Just think about what we've been through over these past several years. A pandemic, protests, economic uncertainty. These are issues that have left deep scars on so many in our community. And while I'm proud to say that the number of shootings, the number of homicides is down over 40% this year alone in our city. Unfortunately, the number of suicides are way up. Last week alone, a half dozen Louisvillians took their lives. And why do I talk about this here today? I talk about this today because Medicaid is the largest provider of mental health services to people in our city. And so if these Medicaid cuts go through, that means fewer therapists, fewer counselors, fewer crisis intervention teams for those in need, more people left untreated, more people struggling in crisis. These are just a few of the consequences. Just think about all the consequences for every other health ailment out there. For those struggling with diabetes, with asthma, with heart disease, with cancer, and so many more. And so I'm here today to support each and every one of you who rely on Medicare and everyone else around our city. We cannot let this happen to those of us in Louisville. We cannot let this happen to any family in any part of our country that relies on Medicaid. So let's say it all together. Are we here for Angela? Yeah! Are we here for Kimberly? Yeah! Are we here for every other parent or guardian that is using Medicaid to help their kids? Are we fighting for them?
Politics, and so it's a story about me and what my family is going through. I sat down, gripping my phone so tight, my fingers ached. This couldn't be right. Medicaid was how my son Xavier got his ADHD medicine, his speech therapy, his brain treatments, his autism, and more. It was also how my mother got her oxygen and her home health nurse. It was the only way I could even think about seeing a doctor for myself and even thinking about going to see a therapist for my mental health services. I tried to remember if I missed a notice, a renewal form, something. I checked my email, my mail pal that was super high on my counter, nothing. I was just cut off. By the time the house awakened, I was already on hold with Medicaid office. My stomach twisting, with each second that ticked by. Xavier was in his chair at his table, spooning yogurt messily into his mouth. My mother was struggling with the TV remote. Her hands were so stiff and slow from her arthritis. After 45 minutes, yes, 45 minutes that I waited, someone finally answered. "Hello, Miss Masden, how can I help you?" I said, "Well, I'm confused because my benefits are cut off." She replies and says, "Ms. Masden, your Medicaid coverage has been terminated due to failure to meet eligibility requirements." I listened to her again and I said, "Okay, say that one more time." She said, "Ms. Masden, your Medicaid coverage has been terminated due to a failure to meet eligibility requirements. But my son, he has a disability. My mother does too. I'm the only one that takes care of them." Well, the woman on that phone, she kind of took a deep breath, like she's had this conversation 100 times today. "It looks like your income increased 2%, which made you not qualified." I had to catch my breath, but I don't even make enough to cover my rent sometimes, most of the time, all the time. She said, "Did you report all of your income?" I said, "Yeah." She said, "Well, that's what did it." I wanted to scream. I wanted to throw my phone against the wall. Instead, I had to press my fingers to my temples and force my voice to stay calm. What am I supposed to do? My son, he needs medication. My mother, why have I bothered even telling you? You don't care, really. You're just doing your job. She said, "Ms. Madsen, you can reapply, but unless your income changes, you likely will not qualify." I just hung up the phone. My hands are shaking. I had done everything right. I had taken every gig, every contract, stretched every single dollar. I worked part-time at a nonprofit organization for that steady income check. Even them, they couldn't even afford to give me benefits. And now, because I dared to make just enough to survive, the state decided we didn't need that help anymore. Xavier clapped his hands, unaware of what was going on and what just happened. He said, "Mama, can I go outside?" I swallowed the lump in my throat and I said, "Yes, baby, you could go outside." As I pushed my mother in her wheelchair on the porch, I thought about what losing Medicaid really was going to mean. And that is when all of the tears came rolling down. In Kentucky, Medicaid covers over 1.6 million people, nearly 1 in 3 residents. It provides health care for nearly half of all children in the state, along with 40% of people with disabilities. Without it, families like mine are left to scramble. We are forced to choose between paying rent, paying lights, or keeping our siblings, our families alive. Xavier's ADHD medicine alone costs more than $500 a month. His neurofeedback treatments, which we call brain treatments, are at least $120 per session, and he needs 30, and we are only on number 10. And my mama's home health nurse, well, that's gone. The state said I made too much. But standing there under this big, beautiful Kentucky sky, I have never felt so broken in my life. I just looked at 2 people that depend on me and said I am failing them. I have spent over a year fighting for reproductive justice as a member of Sister Song, which is an organization. We organize and we advocate for Black women, gender expansive folks to have control over their lives, their health, and their choices. We talk about how reproductive justice means the right to have children, not to have children, and raise them in safe, sustainable communities. We also talk about what happens in a hospital or a clinic, but really it's about what happens when a mother like me is left alone to pick up the pieces after a system has abandoned her. But how am I supposed to do that? How am I supposed to raise my son in a sustainable community when the system that claims to support families is ripped away? The resources we needed to survive are gone. How can I raise Xavier in dignity when this government tells me that making just enough to keep the lights on disqualifies me for keeping him healthy? I think about how Kentucky politicians talk about family values. Okay. And about protecting our life. But life doesn't stop at birth. Life is making sure children get their medicine. Life is making sure elders get to breathe. Life is making sure caregivers like me don't have to break ourselves just to keep my family afloat. Even with this recent policy change, President Trump's administration have only made things worse. The administration's funding freeze, work requirements, funding cuts, the push to privatize Medicaid, it's all on attack of poor people, Black families, and disabled folks like my mother and my son. It has already resulted in chaos, confusion, and concerns in Kentucky. Furthermore, the appointment of Dr. Oz to oversee Medicare. Okay, one more time, I like that. Furthermore, the appointment of Dr. Oz to oversee Medicare and Medicaid has raised alarms. During his Senate hearing, he expressed support for measures like work requirements to manage costs without providing detailed plans to safeguard vulnerable populations. These developments have left many, including myself, uncertain and fearful about the future of our health care. In Kentucky, this situation is particularly dire. The state recently passed the last-minute Medicaid work requirement, mandating that able-bodied adults without dependents who have been on Medicaid for more than a year must meet a certain work criteria. While I understand maybe the intent behind encouraging employment, this policy fails to consider the complexities of individual circumstances. As a single mother caring for a disabled child and an elderly parent, my ability to work full-time is severely limited. Policies like these, coupled with federal funding uncertainties, only serve to push families like mine further into the margins, making it harder to access essential health care services. The fear of losing Medicaid is not just mine alone. At a recent town hall meeting in Louisville, more than 1,000 people expressed their concerns about potential cuts. It was reported that 150 calls were fielded in a single week from people like me worried about their health care coverage. This widespread anxiety underscores the critical role that Medicaid plays in our community and the devastating impact its reduction could have. Standing here today, the safety net that I rely upon is unraveling. It's falling apart. I'm falling apart. My family is falling apart. And I am left to navigate the frayed threads on my own under this so-called beautiful Kentucky sky. Thank you.
Let's hear it for Angela. the world who wants to take away health care from somebody who made 2% more of their income and can no longer have health care for their mom or their child. Wrong is not a strong enough word for what that is. Evil. Number 2, I don't even talk her with us here today. We have Councilman Ken Herndon with us here today. We have Councilman J.P. Leninger with us here today. Know who your representatives are who are standing up for the basic human right of health care. All right, now I'll tell you, we're going to head towards closing this thing out. When you're doing a rally on Medicaid, which is one of the more complex technical issues we deal with in government, I know I was thinking, what in the hell am I going to say today? So I asked my kindergarten daughter on the way over here, what do you think I should say about them cutting Medicaid? And she said, nothing. I said, why not? She goes, what do people care about that? She said, tell them not to litter, that's important. So don't litter. Then I loved her advice next. I mean, keep in mind, she's in kindergarten. She's giving better speeches than I am. And she said, and then tell them you're going to keep Chick-fil-A open on Sunday. And I said, what? And she said, you can't just break them down. You got to build them up a little bit. But seriously, don't litter. Look, this couldn't be more important. This could not be more important.
That's right.
And in some instances, everything they're doing that is cruel and wrong and is unconstitutional and is against everything we stand for, we got to fight, we got to fight, we got to fight. But don't be distracted.
That's right.
Don't be distracted by what they are actually doing. Don't be distracted by the fact they are trying to give a $4.5 trillion tax cut to the richest people in the world while taking your health care. So we're going to talk about what's going on. We're going to talk about what it looks like. We're going to talk about what it means. And then I'm going to tell you what you can do about it. Let's talk about Medicaid. Right? Medicaid is health insurance. Medicaid is health care. And it's health care that 1 in 3 Kentuckians depend on. 1 in 3. A third of our neighbors rely on Medicaid for health care. But it's more than that. 46% of the kids in Kentucky use Medicaid. 46%. The Republicans would round up, so I'm going to too. That's half of Kentucky's kids are on Medicaid. I am sick and tired of the party of family values, of the pro-life party. They're not even pro-birth because half Kentucky's kids are born on Medicaid. What does that mean when half of Kentucky's kids, by the way, a third of our seniors use some type of Medicaid. Our veterans use Medicaid. Why do our veterans use Medicaid? Mayor Greenberg talked about this. He talked about suicide. 17 veterans a day take their own life. 17. And Kentucky's veterans are covered for mental health services by Medicaid. But guess what? It isn't free. And here's the thing they're not telling you. Kentucky gets more money in federal Medicaid dollars every year than we spend as a state for everything else we do. Think about this. We get about $15 billion a year in federal Medicaid dollars to keep our kids healthy, to keep our people able to go to the doctor and healthy, to keep people from dying. We spend $14 billion total, including the money we spend on Medicaid, every year as a state. $15 billion a year in federal Medicaid dollars, $14 billion a year for the state budget. So when you hear Republicans say something like, oh, we're just going to give a little cut in Medicaid. We're just going to cut Medicaid and maybe we'll pass that along to the states. I actually talked to a Republican legislator in Kentucky. And I said, you know what that means if they pass these cuts along to the state. You know what that Republican legislator said? We're fucked. Because we're talking about numbers. And when we're talking about numbers, it's really, what is $15 billion? What is $14 billion? What is $880 billion in cuts to Medicaid? Love you. I'll tell you what it is. When you make these cuts. I talked to a woman named Meg. She's a mom of several kids. Her daughter June is 10 years old. She can't move without a wheelchair. She can't hold her head upright. She can't speak without a computer. She can't hear without the cochlear implant she got. Her mom's working 4 jobs right now to try and make ends meet for her family, to keep her daughter alive. They use Medicaid.
Not a parasite.
No. And I'll tell you what, I met the daughter. And there is no cost that can replace her smile when her mom picks her up. And Medicaid enables her parents to care for her at home with her family. Many of you in this room know if people don't talk about their Medicaid stories, it impacts every single one of us. Bill and Susan Miller, their daughter Lena, is here today. I've known Bill for years. Bill's a Teamster. He works a good job. He has great union benefits. It's not enough in the American healthcare system to take care of your child if they're born a little different. They need Medicaid. When I was in the state Senate, David Turner Jr. wanted to page with me. He came in. He's the exact same age as my kids. He had a rare form of brain cancer. Was already in a wheelchair. He was wearing a red t-shirt that in bright yellow letters said, "Make every day the best day ever." And he wanted to page with me because it's an experience he wanted to have. To be there on the floor of the state Senate. To make that day for him the best day ever. And his parents adopted that slogan because they knew his days were numbered. They were finite. And that someday it wouldn't be the best day ever. He was the exact same age as my twins. And to look at his Pokemon cards and talk to him about Legos and Disney World, it was everything my kids were interested in. His mom's a teacher. She had great benefits. But you try on a good salary to take care of your child who has a rare disease without Medicaid. I want the politicians in Washington to come knock on their door, to tell them that their child didn't deserve those treatments, that their child didn't deserve the medical devices he got because of Medicaid, I want them to stand in line with me at the visitation for David Turner Jr. in a line that wrapped around the church with his 4th grade classmates and balloons, to go in and stand next to a child-sized coffin and tell those parents we wanted to cut costs for a tax break for the rich. That's what Medicaid dollars do for us. No family is immune from this. We went to the doctor for our 24-week checkup with the birth of our twins. They said, everything looks so good, don't come back for another month. My wife called me crying from the emergency room the next day to let me know that her water broke. Our life changed in an instant. I was a lawyer. She worked in corporate America. We had good jobs. We thought we'd done everything right. When you have kids that are born in 1.5 pounds on a ventilator, there is no insurance plan in this country that is prepared for that. We needed Medicaid to cover the cost of our kids. We talk about this in numbers, but there are people, there are lives, there is happiness and hope and humanity and morality all wrapped up in this. And I have 2 beautiful, smelly, attitude-laden teenagers now because of the health care they got, because of what Medicaid enabled. I really don't. That means they're going to cut Medicaid. And let me just tell you, there is not $880 billion worth of fraud in Medicaid. Think about this. There aren't even 880 billionaires in the United States of America. We would know if there was $880 billion in fraud. There's not. They're going to cut Medicaid. They're going to cut programs that hurt us. They're going to cut programs that Angela and David and us and everyone else we've talked about uses. So what can we do about it?
Cut them up.
Here's the thing. You gotta know legislative process to be effective. I told you I didn't want to dip down in the weeds, but this is what we gotta do. The reconciliation bill has passed the House. Barely, but it passed. So where is it now? It's in the United States Senate. In order for that bill to become a law, it has to pass the House and the Senate. So where should we be focused right now? Senate. Every single person in this room has 2 United States senators. It's true. I didn't say you had to like them. I just said you had them. And if you're a United States Senator from Kentucky,
They don't care.
1/3 of the people you represent are on Medicaid. Half of the kids you represent are on Medicaid.
Let them know!
When we did the Affordable Care Act expansion, it was the biggest mover of public health in the history of our state. 440,000 Kentuckians got health care for the first time. And we've made a values judgment in this country. Because we don't talk about this honestly enough. We've already determined that in the United States of America, we are not going to let you die in the driveway of a hospital. That's not true in every country in the world. But in the United States, if you show up in an emergency room, they have to care for you. Now, if you don't have the Medicaid to pay for it, guess what's happening? We're still paying for it, guys. That's the thing. They're not just cutting Medicaid, they're shifting the cost to give themselves a tax break. That is what's happening here. And we have to fight back. Call your senators. Talk to your friends. Talk to your neighbors. Here's the reality. I can get up here every day from now until the Senate takes this up for a vote and scream. Half the people aren't going to believe what I say. But when you go to where you go to church, where you work, where your kids go to school, where they have recreational activities, with your friends that you grew up with here in Louisville, and you tell them what is happening and why. Tell them the stories you heard here today. Tell them you may have never done it in your life, but if you take 30 seconds out of your day and call your representatives and senators in Washington and say, do not take away our health care in Kentucky. That's it. Because this still, for the time being, is a government of, by, and for the people.
Right.
Right, yes.
Even though we've got someone who wants to be king, and the person next to him, and all I'll say is you can't spell felon without Elon. But we have the power, and we have to have the courage to use it. Do not assume someone else is speaking up for you. Make your voice heard. Tell people what's going on. Call your representatives and senators. Organize. This is great. Everybody's here today. Get somebody else's number who's here today that you don't know, because they care as much about this as you do. We have to believe in the power of each and every one of our voices to make sure, because guess what? I told you there's a lot going on. We got to win the Medicaid fight. That won't be the last one. We got to fight to protect our government. We have to fight to protect our people. We have to fight to protect the people you've heard from today. We have to fight to protect each other. We have to take care of each other in this moment. And it is so important. And I want you to know that all of us here are standing up with and for you. But we will all be more successful if we just recognize the simple truth. We are better off if we are all in this together. Take care of each other. Take care of ourselves. Make sure you go out there, raise your voice, and let's keep healthcare where it belongs, in the hands of the people who need it.